you are doing more than what an optician does. Could you possibly just elaborate on that?
Okay. There are two types of optician. There's a dispensing optician and ophthalmic optician, which are also called optometrist. The dispensing optician are basically those who dispense the glasses, take the measurements of the heights of the bifocals and interpupillary distance. And the ophthalmic optician are those who refract, basically find the prescription of what patients required, diagnose the condition of the eye disease, and if it is required to be where there is an abnormality which has been found, then they refer there to the ophthalmologist, to the eye surgeons there, for them to diagnose further investigation.
This community service you are providing for a long time. What do you think are the highlights of this journey?
It's pretty stressful, but I enjoy it, and certainly there is a lot of hurdles from nowadays with NHS as well, which has made the life a little bit difficult. But I tend to get different range of people, different conditions of eyes which I tend to see, and patients appreciate it, and I enjoy it.
What seems to have worked well and perhaps not well?
The thing which has worked very well then is basically that when patients have been diagnosed there with an eye conditions, and they have been is referred there to the eye hospital there with the condition of cataracts and glaucoma, which is basically the major problems which are associated. But there are other conditions like retinal detachment and retinitis pigmentosa. When they're referred there at the same time, patients do appreciate, and they recommend the opticians there to the other people. So it just promotes the name of the practice and myself as well. But the ones which sometimes has caused a hurdle as well is, I assume, just running the business and few the NHS implications.
Looking back, can you recall the very first patient you saw in your professional life, and what was your feeling at the time?
That, I think, because it's such a long time back there, it must be over about 25 years. I don't remember. The only thing I remember that at the same time, it's just nerve-wracking there as well, when I saw the first patient there as well, you know. And it's just that sometimes taking the history and symptoms and things like that did create the problems. But I assume with the time, as the confidence built it up, and I found this was become much easier.
Are we taking good care of our eyes now?
Yes, I think people are becoming very much conscious about the health of the conditions of the eyes. There are some who are extremely conscious of it, others unfortunately not as well. There are people there who probably would come in quite regularly for an eye test there once a year, which they didn't used to do previously in the past. And I do see them, quite elderly people, coming in more and more often there than what it used to be the previously in the past as well.
Can we, the public, do something more to look after and care for our eyes?
Yes, there are a lot of things like health supplements which exist as well, which are very beneficial, which are usually recommended for the patients suffering from age-related macular degeneration. And there are health supplements which consist of lutein, which do exist, Number two, people tend to work on computers, things like that. They tend to spend a lot longer time. They tend to become more short-sighted as well. So they should cut it down working on the videos and computers.
How does the national health situation, which seems to be changing rapidly, how does that affect your work and the care which you provide for patients?
I think the National Health Service are becoming quite stringent there about the way they are handling the matter. Initially, that used to be that people used to come in for an eye test once a year. And nowadays, there are only certain categories where they're only allowed to come in for an eye test once a year as well. It's basically patients under the age of 70, patients who are suffering from diabetes, and the children under the age of 16. For anybody else as well, the people who are on the benefit as well, they can only come in once every 2 years. So what's happening is now, because there are a lot of optometrists that are charging there for an eye test as well. So that's one reason it is people not coming so often, it is. And number two, people who are on the benefits, who used to come in once a year, they're not allowed to come in there once a year. They're only allowed to come in every 2 years. They're not coming as often. So that sometimes has caused trouble as well. Patients not being diagnosed at the right time. And also at the same time, patients sometimes are feared to pay for their eye test as well at the same time, But on the other hand as well, I mean, NHS do allow that if there is any specific problem, if the patients complain, then patients are entitled to come in as well, to come in for an eye test earlier on as well. But I assume that some patients are a little bit quite hesitant there to come in because they think they can only come in every 2 years.